Hi everyone, this is Connor Downey, and you are listening to the Vitalis Podcast.
Hello everyone, and welcome back to the Vitalis Podcast. I am your host, Connor Downey, back for another great episode. First off, thank you all for joining me today. I am so grateful to have every single one of you listening in today. The feedback has been fantastic, so thank you for taking time out of your day to tune in. I'm hoping that I'm able to give more and more small little nuggets of information and help guide all of you. Thank you all for reaching out too. There's been an overwhelming amount of people that have been reaching out, asking for help and advice. And so it has been such a blessing being able to provide some information and some direction to so many people. So thank you so much. Now, today's episode, we are diving into really one of the most controversial, but also one of the most important topics that we can, and that is cancer. Now, those of you who have listened into this podcast from day one, you know that I have a large background when it comes to cancer. I have had several friends and family members that have passed away to cancer and really are the guiding principle behind why I've started this podcast. One of the foundational reasons as to why I got into alternative and integrative medicine and holistic health practices. And it has been life-changing. And I have been able to help so many people. I've seen so many individuals that have had enormous impacts in their life from the very therapies that we're going to talk about today, including being able to directly administer them and work on treatment plans and work with so many physicians and nurse practitioners and PAs in and around their care, naturopathic doctors as well. And so I have had I will say the pleasure of being able to work with so many incredible individuals, so many patients that are just incredible human beings. And I wish that I've been able to do more and more. So I'm hoping that the information that I give to you today, if you are somebody that is dealing with cancer, if you're somebody that has family members that have cancer, if you are a provider and you're just kind of stepping into this space and you want to know more and more about this side of medicine, hoping that I can guide a little bit of that information towards you. So anyone out there is hope. There is a way to heal. So if you are lost, if you are confused, if you're not sure where to turn, I've seen so many people that have gone to their doctors, gone to their oncologists, they've gone the normal Western medicine route, and unfortunately it's a very limited, often protocol, and it's also typically a very limited amount of education that's given to so many people. So hopefully this gives you some hope. Hopefully this gives you some direction in and around everything in cancer, and I'm hoping that this episode gives a little bit of strength and courage to those out there that are fighting through cancer. So if you're listening to this, keep pushing, keep fighting. There is hope. There's ways to heal your body. There are ways to get through this and get past this. Everything that I talk about on this podcast is designed to help and to heal everyone out there. This is not snake oil. This is not a bunch of voodoo. This is truly amazing things that are readily available to people that just aren't talked about enough. And so I have personally seen it with my own eyes. So many people that are healed and have had incredible results from these therapies. And I wish that I had access to them or I had the knowledge that I have now back when my father could have used it, when my grandfather could have used it, when so many people that have been in and around my life could have used it. So if you're listening to this, keep fighting. I hope these therapies can offer you some hope and, of course, some direction. Now, kind of diving into it, truthfully, cancer has been a long seen enemy to destroy at all costs. And unfortunately, we've looked at it with how do we get rid of it with surgeries, with chemicals and radiation as our weapons. But the truth is that there's been a real awakening in and around cancer. There has been a real mindset shift in and around cancer. And the question that so many people have been asking now is, what if healing cancer isn't just about killing tumor cells? What if it's about empowering the body's own defenses and restoring balance in your terrain? And in this episode, we will deep dive, we'll explore alternative and integrative cancer therapies that focus on supporting the immune system, healing the microbiome, and detoxifying the body as crucial steps in cancer healing for so many individuals that are on this journey. And along the way, we'll confront some surprising truths, so get ready for a few bomb drops. And we're ultimately going to look at conventional approaches like biopsies, chemotherapy, and radiation, and why blindly attacking the tumor can sometimes backfire. And our guide will blend clinical science with empathetic and conversational tone because information alone isn't enough. If you are fighting cancer, you also need hope and empowerment. And that's what I'm here to offer you. We'll draw on insights from leading integrative doctors like Dr. William Lee, Dr. Steve Rawlis, Dr. Nathan Goodyear, and others who have pioneered holistic cancer care. We'll back up the discussion with current research and data, with references from curious minds. And by the end, you'll understand how therapies like immune modulation, high dose vitamin C, IV mistletoe, gut microbiome restoration, things like fiber, probiotics, and even fecal transplants. Yes, I said fecal transplants, and detoxification of heavy metals, parasites, and toxins can fit into a comprehensive healing strategy. We'll also touch on some cutting edge or unconventional tools like methylene blue, and yes, even nicotine patches that are being explored for immune support and cancer modulation. So get comfortable. This journey will be informative with plenty of science. It's going to be inspirational with hopefully a lot of aha moments. And above all, it is supposed to be empowering. So whether you are a patient, a caregiver, or you are just curious, I'm inviting you to listen not just with an open mind, but with an open heart, because there is hope outside of just chemo and radiation. And it starts with your own body. So let's dive in. Now, starting off, let's talk about your immune system, which is truly your built-in cancer warrior. It is one of the most powerful weapons against cancer, and it is ready to have at your disposal. Your immune system, and under the normal conditions, our immune cells like T cells and natural killer cells constantly patrol our body and look for budding cancer cells to destroy them, a process that's known as immune surveillance. And cancer develops when those rogue cells manage to evade and overwhelm our immunity. This understanding has led to modern immune therapies like checkpoint inhibitor drugs that release the brakes on the immune system to attack cancer. But here's the thing. Long before high-tech drugs, we can take simple steps to boost our immunity through lifestyle and integrative therapies. So diet and immunity. One of the most effective methods to enhance the immune system is through diet. And that comes directly from Dr. William Lee. I've talked about it on this podcast before, but the foods you eat profoundly affect your immune health. Plant-based, fiber-rich foods feed your gut microbiome, which in turn educates and supports your immune cells. And in fact, dietary fiber is what feeds the organisms that live within your microbiome. So the more of those that you eat, the healthier and stronger your microbiome becomes. And that's directly from Dr. Lee. And why does that matter? Because a healthy microbiome leads to a stronger immunity and even helps protect your DNA from damage. Now, up to 70% of your immune system resides in your gut, and your gut bacteria talks to your immune cells. It guides them and helps them respond properly to threats. And so feeding those microbes, we'll think like vegetables, fruits, nuts, seeds, whole grains. You essentially upgrade your immune army and train and give them equipment. And your gut health are your cancer fighters. That is where your body's has this microbiome's role in cancer defense. It is so crucial that even William Lee has quoted that understanding the microbiome should be part of every oncologist's thinking when healing an individual with cancer. Research is piling up to support all of his claims. Perhaps one of the biggest bomb drops and revelations in recent years is how your gut bacteria and fiber intake can directly influence success of cancer immune therapy treatments. Now, a study of melanoma patients on anti-PD-1 immune therapy found that those who ate at least 20 grams of fiber per day had significantly better outcomes. Each 5-gram increase in fiber was directly linked to a 30% lower risk of cancer progression. And that's directly in a study with high fiber diets and how they can improve the response of melanoma patients in immune therapy. And that's posted on the National Institute of Health website. And in this study, patients with high fiber diets had more robust responses and longer disease-free survival. Whereas, interestingly, those who were taking probiotic supplements, not food, actually had worse outcomes. And so in the same study, it turns out that getting fiber from real food is key. And tinkering with random unknown probiotics might even be counterproductive. Now, the data suggests that one can target composition of the gut microbiome and affect the ability of the patients to respond to immune therapy, and that's directly from the doctor that's leading this study. Now, in plain English, by improving your gut flora through diet or even fecal transplants, you can make breakthrough immune therapies work better. Now, I want to talk about fecal transplants. And this is basically a microbiome reset. And you did hear that correctly. Fecal transplants are indeed being used in cancer care trials. And if your gut microbiome has been devastated by antibiotics or poor diet or toxicity, one way to restore it is by introducing healthy microbes from a donor's stool. And in startling experiments, melanoma patients who didn't respond to immune therapy, these are patients who failed in this standard of care, were given fecal microbiota transplants from patients who did respond. And lo and behold, some of the non-responders started shrinking tumors and responding after the transplant. And this was published in a high fiber diet as well. Essentially, the good gut bugs from the donor helped turn on the recipient's cancer-fighting immunity. And this is cutting-edge therapy, but it underscores a timeless principle that you need to heal the gut in order to heal the immune system. So as far as immune boosting therapies, so beyond diet, integrative oncology often employs natural substances to bolster immunity. For example, medicinal mushrooms like reishi and turkey tail that contain beta glucans that can stimulate immune cells. And in Japan, there's even a turkey tail mushroom extract that is actually an approved adjunct cancer drug due to its evidence of improving survival in some cancers. There's also low-dose naltrexone or LDN, which is another immune modulator that some integrative doctors will use. It's thought to work by temporarily blocking endorphin receptors to trigger a rebound increase in endorphins and immune activity. And this can potentially slow tumor growth. Now, Dr. Steve Rawlis noted that supportive medications such as low-dose naltrexone are gaining momentum in integrative oncology, and it's a way to gently nudge the immune system into cancer-fighting mode. Now, there's also something called mistletoe, which is essentially your immune whisperer in a sense. And we'll dive into mistletoe therapy later, but it is definitely worth mentioning here. Now, European mistletoe extract is a plant-based therapy that acts as a direct immune stimulant, and it is one of the most widely used integrative cancer therapies in Europe, specifically because of the immune benefits and quality of life improvements. Mistletoe basically shakes away the part of the immune system that surveys for cancer, and many patients report feeling better, less fatigue, more appetite, and so many other things on it, and we'll talk more about that soon. Now, before that, the most important thing that I really want to stress for anyone that's going through cancer is stress, sleep, and immunity. Now, no immune discussion is complete without acknowledging that stress, specifically chronic stress and poor sleep, elevate cortisol and suppress immune function. When you look at mind-body practices like meditation, yoga, prayer, guided imagery, they aren't woo, they are measurable effects on immunity. Even something as simple as deep breathing or vagus nerve stimulation can tilt the nervous system toward a reset and repair state, which helps immune cells to do their job. And we mention this because healing is holistic. It is a nutrient dense diet that will physically feed your immune system, but emotional support and stress reduction feed it too, and in a completely different way. And so, in summary on that, a strong immune system is step one into healing cancer. Instead of solely relying on outside interventions, integrative care asks, how can we help the body to fight the cancer itself? And by improving diet, specifically fiber and plant food, repairing the gut health, using immune supporting supplements or therapies, and managing stress, we can create an internal environment where cancer struggles to survive. And this is the core of holistic oncology. Heal the whole person so the person can heal the disease. Now, the gut immune cancer connection. Did you know that feeding your microbiome with fiber can make the difference between immune therapy curing your cancer or not? Patients with melanoma who ate more than 20 grams of fiber a day responded far better to treatment, with a 30% lower risk of progression for every 5-gram increase in fiber. And incredibly, in some cases, a fecal transplant from a cancer survivor to a patient could flip a non-responder into a responder. That's right. So transferring someone's healthy fecal matter halted cancer growth. It's both gross and amazing, and it shows how vital the microbiome is in cancer defense. Now, the next topic that I want to talk about is high-dose vitamin C, specifically IV high-dose vitamin C. That's what we're really diving into because the doses that you can take orally are nowhere near the doses that you can take through the IV. This is basically your fuel for your immune system, and it is a tumor toxin. Now, there is one vitamin that everyone associates with the immune system, and it's vitamin C. And you have probably taken it for colds or flus, but what about cancer? And doses hundreds of times higher than you could ever get from an orange. High dose intravenous vitamin C has emerged as a star player in integrative oncology, and it's actually not new. It was studied back in the 1970s, and only recently has serious clinical research been caught up, and the results are mind-blowing. And here are the basics. So vitamin C, or ascorbic acid, is an antioxidant nutrient. Our white blood cells actually concentrate vitamin C to use as ammunition against infections or perhaps even tumor cells. And the catch is that vitamin C is water soluble and tightly regulated in the body. So if you do take too much by mouth and you max out your absorptions at fairly low levels, IV infusions bypass the gut and can raise blood levels of vitamin C by 100-fold or more compared to oral routes. Now, why does this matter? At high concentrations of vitamin C, it behaves completely different. It becomes a pro-oxidant, not an antioxidant, and in the vicinity of metals, generating hydrogen peroxide and free radicals that can selectively damage cancer cells while leaving normal cells unharmed. Tumor cells have weaker antioxidant enzymes and less ability to clear hydrogen peroxide, so they succumb to the oxidative assault, whereas healthy cells can cope. This has to do with low catalase levels in cancer cells. Catalase protects cells against oxidative stress, and H2O2, which is hydrogen peroxide. When vitamin C converts to hydrogen peroxide and those low levels of catalase are present in the tumor cells and the cancer cells, this leaves cancer cells vulnerable to oxidative stress from hydrogen peroxide, leading to cancer cell death, which is incredible. So that is why high-dose vitamin C has such a major impact. Now, as far as the mechanisms and magic, in pharmacology terms, the pharmacokinetics of IV vitamin C allow a whole new pharmacodynamic. Translated, IV route is equal to super high levels in the blood, which trigger chemical reactions that kill cancer cells and slow their growth. Now, vitamin C in the millimolar range achieved by the IV can cause DNA damage in cancer cells. It inhibits glycolysis, which is cancer's sugar burning pathway, and it depletes ATP energy in those cells. It's a bit like removing the spark plugs from a car engine, and the cancer cell's metabolism essentially will sputter out. And additionally, vitamin C supports collagen production, which can help wall off tumors and prevent them from invading neighboring tissues by strengthening the extracellular matrix. It also enhances immune function, and high-dose vitamin C has been shown to boost the activity of natural killer cells and lymphocytes in some studies. And intriguingly, high-dose vitamin C seems to synergize with conventional therapies, which makes cancer cells more sensitive to chemotherapy and radiation, acting like a radiosensitizer and a chemosensitizer. And we see Dr. Connolly, an integrative oncologist, notes that vitamin C sensitizes cancer cells to radiation, and it helps treatments work much better while possibly reducing the side effects. We also look at clinical evidence. So from controversy to validation, for years mainstream oncology has dismissed IV vitamin C as unproven at best, accurate at worst, but recent clinical trials are turning the tide, and in 2024, the University of Iowa published a phase 2 clinical trial for stage 4 pancreatic cancer. And one of the deadliest, I'll say that again, stage 4 pancreatic cancer is one of the deadliest, most chemo-resistant cancers. And patients who got standard chemo lived a median of 8 months, which is expected. But patients who received high-dose vitamin C with chemo lived 16 months. That's double the survival rate. This was also unprecedented that the trial was stopped early because it was clear that the vitamin C group was doing so much better. Dr. Joseph Cullen, who is the lead researcher on this, specifically said, "We thought it would be a success if we got to 12 months, but we doubled overall survivability to 16 months. And equally important, quality of life also improved. Patients on IV vitamin C reported fewer chemo side effects, better energy, and were able to tolerate more treatment cycles. And that is huge in a disease where treatment is usually debilitating. And it's not just pancreatic cancer. The Iowa group earlier showed in a trial for glioblastoma, which is an aggressive brain cancer, that adding high-dose IV vitamin C to a standard chemo radiation significantly extended survival there too. And a trial in non-small cell lung cancer is also underway. Meanwhile, other studies in the lab and small clinical series have documented cases of regression or stable disease in various cancers with high-dose IV vitamin C, especially with combined with other therapies. Now, Dr. Nathan Goodyear, who is an integrative medical doctor, also frequently uses high-dose vitamin C. And he points out that people really don't realize that high-dose vitamin C can also kill cancer cells outright and in addition to its immune benefits. According to Dr. Nathan Goodyear, vitamin C is a pillar of integrative cancer care, not fringe therapy. I can attest to that personally. Even the National Cancer Institute acknowledges the potential, Preliminary studies show IV vitamin C may improve outcomes and help alleviate symptoms like fatigue, pain, or appetite loss in patients with a very low toxicity profile. Vitamin C IV, when properly administered, is remarkably safe and well tolerated and is far safer than chemo drugs. Our body knows vitamin C. It's not a foreign toxin. And the main precaution is for patients with kidney issues or a genetic G6PD deficiency. If you have a genetic G6PD deficiency or you are going to get high dose IV vitamin C, you need to get a G6PD enzyme test done. It is going to show that what the risk of hemolysis is. So if you are G6PD deficient, you have a risk of hemolysis, which is basically the lysing of your blood cells. You don't want that to happen. A lot of drugs cause this, not just IV vitamin C, but at high doses, anything typically above 15 grams. I wouldn't go above 12 grams of IV vitamin C without a G6PD test done, but above 15 grams, there is a risk of hemolysis. You need to have that test done if you are going to a high dose vitamin C regimen. Now, there's also the opportunity for vitamin C stacking, which is an interesting concept in integrative oncology. And it's basically stacking therapies using multiple treatments in a complementary fashion. Vitamin C is often stacked with others, for example, like hyperthermia, which is heating the body, or the tumor, which can synergize with vitamin C's effects, and with certain polyphenol, which can basically enhance the pro-oxidant effects. They also have something called arsenic trioxide. It's another oxidative therapy that is used with some leukemias. Dr. Goodyear and a lot of his colleagues have talked about vitamin C stacking as a way to augment the physiologic impact of combining these therapies. And this multimodal approach is basically a hallmark of integrative cancer treatment. And it's basically not relying on one magical bullet. They basically employ a broad arsenal of low toxicity tools that together pack a really massive punch. And so, to sum up high dose IV vitamin C, it is a game changer in holistic cancer care. It attacks cancer on multiple fronts, directly via chemical toxicity to the tumor cells, indirectly by bolstering the immune system and weakening the tumor's defenses, and it does so while improving patient well-being during treatment. And as Dr. Cohen has also pointed out, it is very inexpensive. It is very well tolerated, and it can significantly improve outcomes for even the toughest cancers. And we've gone from skepticism to seeing actual patients living longer and better thanks to the vitamin, and that is truly a healing victory. So you look at this and we see that as a quick retouch, vitamin C doubles pancreatic cancer cell survival. Pancreatic cancer is usually a death sentence, but recent trials have found that adding high-dose vitamin C to chemo doubled survivability from 8 to 16 months on average. Even the researchers were stunned, stopping the trial early because the benefits were so clear. And patients on high-dose vitamin C felt better with fewer side effects. So who could have imagined that an old nutrient like vitamin C given in high doses could make such a difference in one of the most hopeless cancers? Now, the next thing that I really want to talk about is IV mistletoe, or mistletoe in general, which is an ancient remedy that comes to oncology. Now, when you hear mistletoe, you probably think of Christmas decorations, but in the world of integrative cancer therapy, mistletoe extract derived from the European mistletoe plant is a revered tool, especially in Europe, where it's been used for decades. Mistletoe might sound folksy, but it's actually one of the best studied alternative cancer treatments with hundreds of trials, many from Germany and Switzerland, examining its effects. It's not a chemo drug. It's a biological therapy that works primarily by stimulating the immune system and improving patient well-being. So how does mistletoe work? Mistletoe extract contains a mixture of bioactive molecules, most notably mistletoe lectins and viscotoxins. These compounds have dual actions, so direct anti-cancer effects. In cells and in animal studies, mistletoe can induce apoptosis or a programmed cell death, and in tumor cells, this basically inhibits their growth. So the lectins basically bind to cancer cell membranes and can disrupt protein synthesis, essentially poisoning the cancer cells. And mistletoe has also shown anti-angiogenic properties, meaning that it can inhibit the formation of new blood cells that tumors essentially need to grow and to function. So as far as immune modulation, and this is where mistletoe really shines, and it's known as a biological response modifier. Mistletoe injections trigger a mild inflammatory reaction. Often patients get a low-grade fever after the shot, which is actually a good thing because it mobilizes our immune defenses. It increases cytokines and white blood cells and essentially rallying our immune troops. And studies have shown that mistletoe can stimulate dendritic cells and shift the immune environment to be more hostile to cancer. And integrative clinics have seen that mistletoe is often used to help restore immune surveillance, especially in patients whose immune systems are beaten down from chemotherapy. And then we see improved quality of life as well. Patients that are on mistletoe frequently report better appetite, improved energy, and relief of symptoms like pain or nausea. Even a 2020 systemic review and meta-analysis of 26 trials confirmed that mistletoe extract produces a significant medium-sized improvement of quality of life for cancer patients compared to control groups. This included benefits in subdomains like reduction in pain and fatigue. It suggests that many patients simply feel better when mistletoe is added. This is hugely important when dealing with a disease and treatments that often make people feel terrible. Now, as far as survival benefits are concerned, this is where we get a little bit more controversial. Some studies and research indicates that mistletoe might also extend survival rates in certain cancers. A pooled analysis of clinical studies, mostly observational, on mistletoe products found that patients given mistletoe had better survival than those who didn't get it, with a combined hazard ratio of around 0.59, which is basically a 41% reduction in risk of death. However, many of those studies had bias and were not randomized, so conventional scientists don't fully accept mistletoe as a life extension yet. Now, randomized trials in the past have been mixed on survival. Some show trends, but weren't powered enough to prove it. And a well-known randomized study in advanced pancreatic cancer back in 2008 showed a strong trend towards improved survival rates with mistletoe, but it wasn't statistically definitive. And on a whole, systematic review concluded that mistletoe clearly improves quality of life and may reduce chemo side effects, but evidence for outright prolonged survival is less clear due to clinical trial limitations. That being said, patients who feel better often live longer, indirectly, because they can continue treatments and maintain nutrition. And ultimately, look at the connection between cancer and our mental well-being. There are direct links to how we feel, our mental status, and the progression of disease. Now, how it's given. Mistletoe is usually given by subcutaneous injections, like an insulin shot under the skin, several times a week, with the doses gradually escalated. Sometimes it's given intravenously for higher dose purposes and kind of like a pulse dose. Each formulation is its own dosing protocol, but patients often experience a local skin reaction like redness or swelling at the injection site and a brief fever or flu-like feeling, and that's considered a sign that it's working to stimulate immunity. Now, over time, these reactions often lessen, and as the body adapts, mistletoe is typically continued for months or even years as a long-term adjunct therapy. It's generally very safe. Allergic reactions are rare but possible. And because it's an immune stimulant, it's usually avoided in leukemias or lymphomas where an overly strong immune reaction could be risky. So keep that in mind as well. Now, integration with conventional therapy. One reason mistletoe is embraced in places like Germany is that it integrates well with standard treatments. It doesn't interfere with chemo and radiation in a negative way. Instead, it tends to reduce the side effects of those treatments. Now, patients on mistletoe have reported less fatigue during chemo, less neuropathy, and better mood. There's also some evidence that mistletoe may have radioprotective effects on healthy tissue while making tumor cells more radiosensitive, though more research is needed. Oncologists in the U.S. are beginning to take interest. Johns Hopkins University specifically recently conducted a phase 1 trial of IV mistletoe in solid tumor patients to assess safety, and it reported that mistletoe was safe and showed some signs of benefits. The lead investigator, Dr. Powler, noted it was promising in some areas for further study, specifically for improving quality of life in metastatic cancer. Now, patient perspectives, which I think is really the most important area. Many integrative cancer patients swear by mistletoe as a crucial part of their healing journey. It's not uncommon to hear things like mistletoe gave me back my energy, or I feel like it's keeping my cancer in check. While anecdotes aren't proof, they add to the picture when backed by plausible science. Importantly, mistletoe treatments is individualized. Practitioners adjust the type and dose based on how the patient responds. And this is very important. From one size fits all approach of, standard chemo, it aligns with the holistic philosophy, treat the patient and their immune system, not just the disease. So mistletoe therapy can be thought as a fertilizer of sorts for the immune system and a weed killer for the tumor, all derived from a humble plant extract. And it exemplifies the integrative approach, using nature's tools to strengthen the body and attack the cancer gently with a significant track record of improved well-being and a plausible contribution to tumor control. Mistletoe is increasingly being viewed not as an alternative, but as a sensible complement to standard care. Now, rebuilding the microbiome, fiber, probiotics, and fecal transplants. We've touched on microbiome earlier, but it's important that it deserves its own spotlight. The gut microbiome, those trillions of bacteria and other microbes living in your intestines, have emerged as a key player in cancer development, prevention, and in treatment. It influences inflammation, immune surveillance, nutrient absorption, even hormone regulation, and an imbalanced microbiome or dysbiosis can promote chronic inflammation and immune dysregulation, creating a pro-cancer environment. And on the flip side, a healthy, diverse microbiome can produce compounds that protect against cancer and help the body to respond to therapies. Now, fiber. Let's talk about fiber. The microbiome's best friend and a cancer foe at that. Dietary fiber found in vegetables, fruits, whole grains, legumes is essentially microbiome food. Now, humans can't digest fiber, but our gut bacteria ferment it into short-chain fatty acids like butyrate, which have anti-inflammatory and anti-cancer effects in the colon and beyond. And high-fiber diets are consistently linked to lower risk of colon cancer and others. But what about after a cancer diagnosis? Emerging research shows that fiber may improve outcomes then as well. Now, we discuss the striking melanoma immune therapy study. Patients with sufficient fiber intake had better progression-free survival. Now, another analysis in cancer patients found that those who ate more fiber had higher diversity in their gut microbes and tend to respond better to treatments. Fiber also helps by keeping bowels moving, which is important during chemo as many get constipated, and that ensures that toxins, including used up by chemo drugs and carcinogens, are excreted rather than sitting in the colon. Now, one unexpected caution from the melanoma study: probiotic supplements in pill actually correlated to worse outcomes. Why? It could be that taking just a few strains in high amounts disturbed the natural ecosystem balance. It might crowd other important species. The lesson, instead of downing generic probiotic pills, is often better to feed your native good bugs with fiber and fermented food. Each person's microbe is going to be unique, and diversity is key. Eating a diversity of fiber types, soluble, insoluble, resistant starches, encourage a rich microbial garden. Probiotics and prebiotics in practice. Now, this isn't to say that probiotics have no role. Certain situations, especially after antibiotics or in specific imbalances, warrant targeted probiotics. For example, lactobacillus and bifidobacterium are strains that are known to strengthen the gut lining and produce beneficial acids. Now, there are intriguing studies where adding particular probiotic strains improved anti-cancer immune responses in mice, but in humans, results are mixed. A safe approach that integrative doctors often recommend is to consume fermented foods such as kefir, yogurt, sauerkraut, kimchi, kombucha, which all contain a broad array of live microbes plus postbiotics and nutrients. These can essentially seed the gut, whereas isolated probiotic capsules may or may not colonize effectively. Now, targeted strains are also really important. Getting the right kind of strains, like we talked about, lactobacillus, bifidobacterium, akkermansia, these are going to directly feed the important, most crucial bacteria in your GI system. So finding a very good source of bacteria, like we just spoke about, is important, or finding a very well-versed and strategically placed probiotic and prebiotic is going to be very important for your GI system. Okay. Now, as far as fecal microbiota transplants, we have to talk about what is perhaps the ultimate probiotic, and that's transferring an entire community of organisms from a healthy donor. And fecal microbiota transplants, or FMT, is now a standard of care for recurrent C. diff colitis, which is an infection, but in cancer, it's experimental. Now, apart from melanoma and the immune therapy successes, trials are beginning in other settings, like using FMT to mitigate bone marrow transplant complications or to restore immunity after intensive chemo. There's even an angle of using FMT to reduce graft versus host disease in leukemia patients, since balanced gut flora can calm immune overreactions. And if you think about it, after heavy chemo or antibiotics, a cancer patient's gut might be like a burned forest. And FMT is like replanting a mature forest ecosystem in one go, rather than waiting years years and years for it to regrow from seeds. Now, FMT isn't without challenges. Finding a healthy donor, screening for pathogens, and some of these other factors come into play. But the science behind it is sound, and we are symbiotic with our microbiome. Some other integrative clinics, in lieu of FMT, are using a spore-based probiotic, which survive to colonize better, or symbiotics, which are a combo of pre and probiotics to try to significantly reshape gut flora. It's less dramatic of an approach than FMT, but can still help. Now let's talk about microbiome and remission. There is speculation and some early evidence that patients who achieve long-term remission often have a robust microbiome. For example, one study found that higher levels of certain Clostridia and a couple other species in cancer survivors compared to those with active disease. These bugs produce butyrate and can help maintain gut immune homeostasis. They also have organic diets, free from pesticides, rich in microbial diversity from the soil, and this can also contribute to healthier microbiome. Eating organic may reduce exposure to glyphosate and herbicides that some research suggests can disrupt gut bacteria. In fact, French cohort study of nearly 69,000 people found those who consumed the most organic food had a 25% lower risk of developing cancer compared to those who ate the least organic. The biggest difference we're seeing in postmenopausal breast cancer and lymphomas. While correlation isn't causation, one theory is that avoiding pesticide residue, many of which are antimicrobial, protect the microbiome and reduce toxic load, thereby lowering cancer risk. So for somebody who is already fighting cancer, choosing organic, clean foods might similarly reduce those burdens from the immune system and the microbiome, allowing them to function better. We see this a lot also when we do parasite cleanses. So why we talk about increasing pre and probiotics during a parasite cleanse, anything that is antimicrobial, that is going to flush out the GI system, similar to this, has a high impact on gut microbiome, which is why it is important to make sure that you're taking care of your GI system with healthy pre and probiotics. Now, putting it into action. In practical terms, an integrative cancer care path almost always includes a nutritional program, high in fiber, high in phytonutrients, and devoid of processed junk that harm the gut flora. Prebiotic foods are emphasized. These include garlic, onions, leeks, asparagus, oats, flaxseed, bananas, apples, etc. Now, all of these contain fibers that feed beneficial bacteria. Sometimes specific prebiotic supplements like inulin or resistant starches are used to feed the gut bacteria, though one should introduce those gradually to avoid gas. If a patient has taken a lot of antibiotics or has a history of poor diet, a comprehensive stool analysis might be done to see the state of their microbiome. If it shows major imbalances, say very low beneficial strains, overgrowth, or pathogenic strains or yeast, a practitioner might use botanical antimicrobials or even antibiotics to knock down the bad stuff and then repopulate with good flora, basically weeding before planting the garden. This weed and seed approach can sometimes alleviate systemic inflammation. For example, clearing a chronic parasite or dysbiosis can reduce an immune distraction. Now, the gut barrier and leaky gut, which is another factor in healing the gut lining. And many cancer patients have leaky gut from stress, chemo, poor diet, meaning the intestinal lining is more permeable than it should be, allowing toxins or bacteria to essentially pour into the bloodstream and cause a whole host of inflammation. Nutrients like glutamine, omega-3 fish oils, vitamin D, and zinc can help nourish and repair the gut barrier. Some clinics use bovine colostrum or a lot of other serum-derived immunoglobulins to bind and neutralize gut toxins. All of this indirectly helps the cancer fight by reducing the overall inflammatory load and immune distraction. Now, in essence, restoring your gut microbiome is like rehabbing your personal internal ecosystem. It may not sound as high-tech as gene therapy, but its impact is profound. And as Dr. William Lee emphasizes, eating in a way that supports your gut microbes is one of the simplest and most powerful ways to help your body defend itself. And now we have tangible proof from reduced cancer risk in those with healthy diets to better treatment responses tied to gut health. And for cancer patients that are tending to microbiome, it can truly be the secret weapon that tilts the scales in the favor of remission. Now let's talk about detoxification. So removing heavy metals, parasites, and toxins. Cancer doesn't develop in a vacuum. It arises in the context of a body that has often been assaulted by various toxins, infections, and stressors over the years. Many integrative doctors view detoxification as a crucial step on the healing path, especially cleaning out the terrain so that cancers cannot thrive. This means identifying and reducing your body's burden of heavy metals, industrial chemicals, and even chronic pathogens like parasites that may be undermining your health. Heavy metals, which are a hidden threat. Metals like lead, cadmium, mercury, and arsenic are prevalent in our environment. They're in our air, our water, our food, old paint, fillings, etc. They're everywhere. They are not inert exposures. They can be carcinogenic and immunotoxic. For example, cadmium and arsenic are known human carcinogens, and lead is a probable carcinogen. These metals can generate oxidative stress and DNA damage in cells, contributing to all kinds of cancer initiation. But beyond triggering cancer, they also sabotage the immune system. And so we saw in a 2020 review, they found that lead and cadmium disrupt the function of T lymphocytes and other immune cells, upregulating inflammatory mediators and altering cytokine production, ultimately suppressing effective immunity. Cadmium exposure, for instance, caused T cells to undergo apoptosis, which is cell death, and skews immune responses towards a tumor-promoting environment. So if your immune army is weakened by heavy metals, it's not catching cancer cells like it should in early stages. Moreover, heavy metals can act like estrogen mimics or endocrine disruptors. Cadmium has a pro-estrogenic effect, which might fuel hormone-sensitive cancers. They also can interfere with critical mineral balances. For example, too much lead can displace calcium, which affects cell signaling. And so you need to detoxify these metals. So integrative physicians often test for heavy metals and look for a heavy metal burden using blood, urine, hair analysis. If levels are high, therapies like chelation can help remove them. So chelation often involves administering agents like EDTA, DMSA, DMPS that bind to metals and help accelerate the excretion. There's also a gentler approach using supplements like acetylcysteine or NAC, alpha lipoic acid, vitamin C, selenium, zinc. All of these can support your body's natural detox pathways and displace metals from different binding sites. We've also talked about a lot of other natural chelators like zeolite and spirulina and cilantro and a lot of other herbs. So take that into account. But acetylcysteine boosts glutathione, and that is the liver's master antioxidant that helps conjugate and eliminate toxins. Even Dr. Steve Rollins recommends N-acetylcysteine, glutathione, and selenium and zinc as key supplements to neutralize free radicals and aid in detox. Now, foods that can help too. If you look at sulforaphane and broccoli sprouts, this upregulates detox pathways that clear carcinogens. Pectin, which is in apples and citrus, can bind to metals in your gut. And in fact, Dr. Rawls suggests pectin-rich foods like apples, avocados, citrus, and herbs like parsley for heavy metal detox support. Lifestyle practices are also a big piece here as well. So sweating therapies, exercise saunas can help you excrete and flush out a lot of metals through your skin. One fascinating approach is that using niacin, which is B3, to induce flushing and sweating in the sauna, something originally pioneered to detox 9/11 firefighters. Niacin dilates capillaries and may mobilize fat store toxins. And so then sweating can also help eliminate them. Dr. Rawls mentions using niacin along with a sauna and even magnetic clay baths to pull out toxins. We look at bentonite clay as a bath in conjunction with using niacin and any kind of sweat therapy to kind of push those heavy metals out of your skin. And then we look at parasites and chronic infections. It may be surprising, but chronic infections, including parasites, bacteria, viruses, can both cause cancer and hinder recovery. And the clearest example are viruses like HPV, which cause cervical cancer, hepatitis B and C, which cause liver cancer, and H. pylori bacteria, which cause stomach cancer. But what about parasites? There's evidence that certain parasitic infections, specifically in our bladder or in liver flukes in the bile ducts, can directly cause cancers in those organs by chronic irritation and immune evasion. Beyond specific cancers, any chronic parasite in the gut or tissues keeps the immune system busy and often is suppressed and dysregulated and unable to essentially attack those cancers that come up. It dampens our immune attack basically to survive. And chronic immune distraction or suppression might give cancer cells an opportunity to grow unchecked. So as far as an anti-parasite protocol, patients might be given anti-parasitic medications such as ivermectin or fenbendazole, which are basically herbal formulas. And if tests or symptoms suggest that you have a parasitic load, they'll be prescribed. Remarkably, drugs like fenbendazole, which is a common deworming drug, or ivermectin, which is famous as an anti-parasitic drug, have shown direct anti-cancer properties in labs and in animal studies. Fenbendazole has inhibited tumor growth and even made some tumors vanish in case reports. There are clinical trials that are ongoing in brain tumors. Ivermectin has been found to trigger cancer cell death and sensitize cancers to chemotherapy. Integrative oncologists incorporate low-cost repurposed drugs like these as part of an anti-cancer regimen, not only clearing out possible parasites, but getting a basically 2-for-1 kill parasites and hurt the cancer cells at once type of approach. Now, for basically like a gut cleanse, herbal remedies like clove, wormwood, black walnut are also used traditionally, and the goal is basically a gut environment clean of unwelcome guests in a body where the immune system isn't constantly sidetracked. You also look at other toxins. As far as other toxins are concerned, that's kind of a broad term, but in this context, this includes things like residues of pesticides or plastics, which can be and act as endocrine disruptors, mold from water damaged buildings or from foods, residual chemotherapy or anesthetic agents, and even byproducts of our own metabolism that need clearing. The liver, kidney, lymph, and skin are our detox organs, and an integrative plan often includes supporting these organs. For example, milk thistle or glutathione for the liver, with ample hydration and herbal diuretics for your kidneys, a dry brushing or massage for lymph movement, and sweating methods for your skin. Techniques like even coffee enemas are popularized by a lot of different therapies. Those also stimulate glutathione and bioflow to help the liver dump toxins. While coffee enemas are unconventional, many patients report that they help relieve pain and detox symptoms, and there is some physiologic rationale, increased antioxidant enzyme activity in the liver, for example. But ultimately, why does detox matter for cancer? Think of trying to grow a garden in poison soil. Now, you might get some growth, but it will be stunted and unhealthy. Now, think of trying to heal your body, which is also your garden, while it's laden with poisons or infections. Now, removing those, you create a fertile ground for healing. And patients also describe a brain fog that lifts or a surge of energy after a successful detox protocol. And that's the body no longer bogged down by as many harmful chemicals or substances. From a cancer standpoint, detoxification might slow cancer growth indirectly. So removing xenoestrogens, chemicals that mimic estrogen, can help in estrogen-driven cancers. Reducing heavy metals induced oxidative stress means fewer DNA mutations. Plus, many toxins like PCBs, dioxins, basically lodge in fat tissue, including breast tissue, and are linked to cancers. Mobilizing and excreting these could remove triggers that might be fueling your tumor cells. Even Dr. Steve Rollins often advises detox strategies before and after something as routine as diagnostic scans, because even CTs and PET scans involve radiation or contrast dyes, and he notes that drinking lots of water, IV vitamin C, glutathione, and taking detoxifying herbs might mitigate oxidative stress from scan radiation. It's a similar concept with chemotherapy, and so some integrative docs give detox supplement support during chemo cycles to help the process where these drugs can reduce collateral damage. This does not mean that the detox cancels out the chemo. When done properly, it actually can enhance the tolerance of the treatment. And we even see tons of cancer patients develop high liver enzymes, so they ultimately will see great benefits with high-dose acetylcysteine and high-dose glutathione in reducing that toxic load on their liver. In summary, detoxification in cancer care is about unloading the camel that's carrying one too many straws. Cancer was the last straw. And to help the camel get back up, you remove the burdens, clearing the heavy metals and restoring the immune vigor, eliminating parasites, frees up the immune resources, and cleansing stored chemicals lowers inflammation. It's about creating a body terrain where cancer finds it hard to survive. As the famous integrative oncologist Dr. Nicholas Gonzalez used to emphasize, get the garbage out, and the body can often heal itself when given the right nutrients. Here's a huge shocker. A landmark study found that chemo contributes only 2% to a 5-year survival in adult cancers on average. We'll discuss this more soon, but meanwhile, heavy metals like cadmium and lead, which many of us have in our bodies, are known to cause cancer and cripple our immune defenses. We seldom hear about detox in mainstream cancer care, yet it's crucial. Case in point, cadmium is a classified carcinogen that also kills T cells, the very cells that you need to fight tumors. So while oncologists focus on blasting the tumor, integrative medicine asks, what underlying poisons can we remove that might be sparking and fanning the tumor flames? Now, moving into some innovative and uncontroversial therapies, let's discuss two integrative tools that you might not associate with cancer: methylene blue and nicotine. These are not mainstream cancer treatments by any stretch, but they are gaining a lot of attention and integration in research circles for their unique effects on biology. Methylene blue, for example, is a century-old medicine and actual blue dye that's used historically to treat malaria and methylhemoglobinemia, which is a blood condition. Now it's being used for everything from Alzheimer's to infections. In cancer care, methylene blue is now being explored primarily in two contexts: as photodynamic therapy and metabolic therapy. As far as photodynamic therapy is concerned, methylene blue is a photosynthesizer, meaning if you expose it to certain wavelengths of light, it produces reactive oxygen species, specifically in photodynamic therapy or PT. This methylene blue can be injected or applied to a tumor, and then red light or near infrared light is basically shown on it, causing a burst of free radicals that can kill cancer cells locally. A systemic review of preclinical studies found that methylene blue based PDT was effective at reducing tumor size in models of colorectal cancer, melanoma, and others. It seems to selectively kill tumor cells while sparing normal cells, likely because the tumors may uptake more of the dye or are more susceptible to the oxidative damage. And so PDT with MB is still investigational, but it's a neat synergy of an old chemical with modern light technology. I have personally seen a lot of people that have started taking it and having a lot of anecdotal experiences where they have remarkable improvement in their cancer, increase in their energy levels, their serotonin. So when we also look at on the brain side and how you're feeling, there's a massive improvement there. Now, that also comes into it being a metabolic modulator. Cancer cells often have aberrant metabolism. You look at the Warburg effect, which is preferring glycolysis even when oxygen is present. Methylene blue has a unique property in mitochondria. It can shuttle electrons within the electron transport chain. It's been shown that methylene blue can disrupt cancer cell mitochondria function. Specifically, it can soak up electrons from NADH or nicotinamide adenine dinucleotide and donate them to oxygen bypassing parts of the chain. This can both increase reactive oxygen species in cells and decrease ATP production, which stresses cancer cells. One study on ovarian cancer in mice actually found that methylene blue treatment slowed tumor growth, especially in chemo-resistant tumors. Another research avenue in methylene blue as an inhibitor of heat shock proteins. And we look at some of these proteins that cancer cells use to survive stressful conditions like chemo and heat. So by inhibiting something that's called HSP70, methylene blue makes cancer cells less resilient to stress and more prone to death, which is highly interesting. Now, as far as immune effects, there are suggestions that methylene blue might enhance immune cell function. Some preliminary reports indicate that methylene blue can improve macrophage and NK cell activity. Now, this is not well studied yet, but if it is true, methylene blue could have mild immunotherapy roles by revving up the innate immune system against cancer. Now, clinically, how might this be used? It's not a standard protocol, but some integrative doctors might use low-dose oral methylene blue, which also can help with chemo brain fatigue. We talked about the benefits as far as energy and mental focus, or IV methylene blue as well in combination with light therapy. Now, doses have to be managed carefully. Too much methylene blue can cause serotonin syndrome in those that are on antidepressants, so it's very important before you take methylene blue, you should not be taking it or mixing with anything that can increase those serotonin levels, and it turns your urine blue as well, so that's another thing you need to keep in mind. It's a harmless side effect, but it is obviously something to be aware of. Interestingly, methylene blue is being tested in a trial for mouth inflammation. And because it has this antiseptic and potential regenerative properties for tissue, they're seeing some very interesting and profound benefits. So methylene blue's appeal is that it's relatively safe. It's been used for decades in other conditions. It's dirt cheap, yet it targets fundamental vulnerabilities in cancer cells, energy production, and stress tolerance. It exemplifies the approach of repurposing old drugs for new tricks. Now, when we look at nicotine patches, there is a surprising support. Nicotine, the additive that is found in tobacco, which is generally villainized in cancer, rightly, because smoking causes cancer. So why on earth would nicotine patches be considered in cancer therapy? Two potential reasons: cognitive support and immune modulation. So for the first one, cognitive support or chemo brain. Nicotine is a potent nicotinic acetylcholine receptor agonist in the brain. In low controlled doses like patch or in certain chews, nicotine can enhance attention, memory, and cognitive processing. Vanderbilt University has been researching nicotine patches for chemo-induced cognitive impairment, or chemo brain, in survivors, and preliminary studies in other populations like in Alzheimer's and mild cognitive impairment. They have shown that nicotine patches have led to improved cognitive scores compared to the placebo. So for a cancer patient struggling with brain fog, fatigue, depression, a nicotine patch might provide a neurostimulating pick-me-up, and it's certainly less harmful than smoking since you avoid the combustion byproducts. Of course, nicotine is addictive, but short-term supervised use in a medicinal context is different from chronic smoking. Now, as far as immune modulation, this is counterintuitive, because smoking is known to worsen outcomes in cancer patients. It's associated with higher risk of reoccurrence and treatment complications. However, nicotine specifically has a specific effect on the immune system. It activates the cholinergic anti-inflammatory pathway via the alpha-7 nicotinic acetylcholine receptors on the immune cells. This tends to reduce the release of inflammatory cytokines like TNF-alpha in diseases like ulcerative colitis and inflammatory bowel disease. Nicotine patches have actually been used to help induce remission by calming gut inflammation. In the cancer context, one could hypothesize that if a patient has excessive inflammation that's causing wasting or other perineoplastic symptoms, nicotine might dial down the inflammatory response a bit. Now, there have been some remarkable evidence in certain situations with people that are using a nicotine patch to open up detox pathways and actually seeing remarkable benefits on cancer cells. Dr. Nathan Goodyear has commented on the unspoken benefits of nicotine patches in some podcasts, noting that any intervention that improves patient functionality or quality of life can indirectly help their overall cancer journey because they can continue treatments, exercise, and avoid severe depression. But integrative experts would agree no one should smoke. The goal isn't to take up nicotine broadly, it is to see if a very select case the drug nicotine can be repurposed medicinally. Now, one of the things I really want to dive into is the dark side of conventional treatments like biopsies, chemotherapy, and radiation. Now, what you're not often told. Now, we have talked about building the body's healing capacity. Now, we need to talk about the elephant in the room, which is conventional cancer treatments, namely tumor biopsies, chemotherapy, and radiation. These are often necessary and life-saving tools. Integrative oncology typically uses a blend of conventional and alternative. For example, paired chemo and natural therapies mitigate the effects or enhance efficiency, but it's critical to understand that these approaches come with significant risks and downsides that are equally under-communicated. Now, to patients, empowerment comes from full information, knowing not just the benefits, but also the dangers and poor outcomes associated with these interventions, so you can make informed choices and incorporate strategies to counter those dangers. Now, let's talk about the hidden risks of biopsies, the do no harm dilemma, essentially. A biopsy, taking a sample of a tumor tissue with a needle or a knife, is often considered the essential first step in diagnosing cancer. It provides tissues for pathology to determine cancer types and aggression. However, disturbing a cancer can have unintended consequences. There's an old saying, don't poke the bear. And when we poke a tumor, sometimes the cancer wakes up or spreads and we get tumor seeding, which is a phenomenon where cancer cells get dislodged by a biopsy and implant everywhere. And it does happen, especially in certain cancers like melanoma, sarcoma, or kidney tumors. Now, even beyond mechanical seeding, new research shows that biopsies can create a pro-metastatic environment. In 2023, there was a study in breast cancer that found by doing core needle biopsies triggered wound healing responses that actually made the area around the tumor more favorable to metastasis. The biopsy caused an influx in M2 macrophages, cells that promote tissue repair, but also tumor growth. Increased COX-2 and prostaglandin E2, and led to more cancer cells disseminating into the body into those critical weeks before surgery. In mice, blocking this inflammation with COX-2 inhibitors reduced the metastasis caused by biopsies, but the author concludes the needle biopsy of ER breast cancer provokes progressive pro-metastatic changes. Another experiment showed that mice who had a biopsy to their breast tumors developed significantly more metastasis than mice whose tumors were not biopsied. Essentially, the physical insult made the cancer cells more mobile and aggressive. Now, clinically, there are instances where biopsies are suspected to have caused spread. For example, some surgeons won't biopsy liver tumors if they're likely to be cancerous. They go straight to removal because poking can seed tumors along the needle track or into the peritoneum. Fine needle aspiration of thyroid cancers can occasionally seed along the needle path, though rare, and even prostate cancer, though there's a small risk that biopsy can push cells into the bloodstream. Now, should you avoid biopsy? Now, in an integrative care, some patients choose to avoid an immediate biopsy, especially if the imaging or blood markers are already strong enough to indicate cancer. They might opt to first implement immune boosting or anti-cancer therapies, especially to strengthen the terrain before an invasive procedure. If a biopsy is necessary, integrative docs might advise doing things around the time of the biopsy to mitigate the spread. For example, using natural COX-2 inhibitors like fish oil or turmeric. Now, what they are saying is that liquid biopsies or blood tests for tumor DNA markers are emerging. They aren't fully replacements for tissue biopsies yet, but they can sometimes give specific information like certain mutations without physical invasion. In the future, we'll likely rely more on those. Now, here's some key takeaways. A biopsy is not benign. It's a small procedure, but one that can potentially spill cancer or incite it. Thus, it should be done only when truly needed, and ideally when the patient's immune system is supported to clean up any released cells. So here's ultimately the last few words that I have as far as a take on it. I highly recommend staying away from biopsies. There is enough research to conclude that anytime that we biopsy cancer, we have a substantial risk of releasing these cells and ultimately spreading cancer. It is best to, even if benign, go in and take these alternative therapies to begin shrinking this tumor. Ultimately, what we see, which is very profound, is that the body's tumors are actually designed to prevent the spread of cancer. We have tumors in our body for a reason. These tumors develop to encapsulate cancer and prevent metastasis and spread. So that's exactly what our body is designed to do. It is designed to encapsulate these cancers, to protect us, to heal our body and allow our body to work on it. Now, our body has already started the process of protecting itself by forming these tumors. Now it's our responsibility to start giving it the necessary means to fight it off and to kill it, and reducing the toxic load in our body so that way our body can go forth and do that. So stay away from biopsies as much as possible. The next thing I want to talk about is ultimately chemotherapy. Now, chemo has been a mainstream cancer treatment for decades. It has, without a doubt, saved several lives. However, for most common solid tumors, especially in advanced stages, chemo's benefits are modest and its toxicity is profound. And not just the acute side effects like nausea and hair loss, but long-term damage to the body system. So let's ultimately address the elephant. In 2004, Australia scientists Morgan, Ward, and Barton published an analysis asking what is the overall contribution of curative/adjunct cytotoxic chemotherapy to a 5-year survival in adult malignancies. Their answer, 2.1% in the US and 2.3% in Australia. In other words, over 97% of the improvement in survival since 1975 came from things other than chemo, like surgeries, early detection, or newer targeted drugs. This study shocked the oncology community. Some argued that the method was too crude, but even if the exact numbers are debated, it highlighted that for many cancers, chemo offers only a few percent benefit in long-term survival. For instance, chemo is very effective in some testicular, lymphoma, or childhood leukemias, but in big killers like lung, colon, breast cancers, its impact is very limited. So let me touch on that again. We're basically saying that chemo is giving a less than 3% survival rate for these cancers. Now, meanwhile, chemotherapy can wreck your immune system, sometimes for very long periods of time. Research from Fred Hutch showed that after certain chemotherapies for breast cancer, patients' immune system, specifically parts of cellular immunity, were still suppressed for 9 months after treatment. Chemo often causes neutropenia, so low white cells, forcing dose delays or reductions and leaving patients open to infections. It can damage the bone marrow stem cells, leading to anemia, sometimes permanently, and some chemo drugs cause secondary cancers years later. Treatment with some of these alkylating agents or some of these other inhibitors can cause leukemia down the road, and radiation has similar issues. Now, for example, women who got chemo for breast cancer have a small but real risk of developing leukemia 5 to 10 years later as a result of the chemo. And another issue, chemo resistance and tumor aggressiveness. Chemo drugs often kill the bulk of the tumor cells, but may spare a subset of hardy cancer stem cells or persistent cells. And those can proliferate in a sort of rebound effect, sometimes coming back far more aggressive since you've already selectively killed the weaker cells. There's a phenomenon where certain chemotherapies can stimulate tumors to adapt and even become more invasive. For instance, chemo can induce more expression of surface proteins like PD-L1 on tumor cells, making them hide from T cells, or increase stemness traits in residual cells. Some studies on breast cancer showed that after chemo, residual tumors had higher proportions of cancer stem cells than before, and this suggests that while tumors are shrinking initially, the composition shifts towards cells that can actually drive metastasis later. Now, also, dying tumor cells from chemo can release inflammatory cytokines or even growth factors that paradoxically stimulate any remaining cancer cells. From a patient's perspective, chemotherapy is exhausting. It can disseminate quality of life, sometimes to an extent that makes patients question if it's even worth continuing. And this is where integrative strategies can help. They help mitigate the side effects with nutrients, acupuncture, things like that, so patients can tolerate treatment better. But there are times where stepping back to assess chemo's real benefits are wise. And for late-stage cancers with poor responsive rates, sometimes shifting focus to quality of life or immune therapies are far more sensible. It's a personal decision, of course, but quality versus quantity and hope for a slim chance of prolonged survival versus certain toxicity is now. And when we look at radiation therapy, it is another conventional modality. It can curate in certain localized cancer, and it does this by essentially causing DNA damage, and not only to the tumor, but to so much surrounding and healthy tissue as well. So there's a lot of collateral damage when it comes to radiation. When we look at the acute side effects, now this depends on the area treated, of course. When we look at pelvic radiation, can cause bowel issues. Head neck radiation causes mouth sores and swallowing difficulty. Chest radiation can inflame the lungs and the heart. A lot of those often resolve, but it's late effects that are concerning. When we look at secondary cancers, radiation is a proven cause of cancer itself. For example, if you get chest radiation from Hodgkin's lymphoma at age 20, by age 40 or 50, your risk of breast cancer and sarcoma in the field is significantly elevated. Data shows that about 8% of cancer in survivors can be attributed to radiation. In one large analysis, patients who had external beam radiation had a 5-year to 15-year cumulative incidence of secondary cancers of 27.5% compared to 22% in those who had surgery instead, an absolute 5% increase. The risk is especially high in younger patients and in tissues like breast cancer, thyroid cancer, lung cancer. For instance, women under the age of 45 who receive chest radiation have high risks of breast cancer later. We look at a 1.5% increase in relative risk. Now, tissue damage and immunity. We look at radiation, things like scar tissue and blood vessels. If lymph nodes are radiated, it can cause lymphedema or chronic swelling. If bone marrow bearing areas are radiated, it reduces blood cell production in that area permanently. Radiating pelvic bones, for example, can lower the reserve of stem cells that make immune cells. And there's emerging evidence that radiation can have systemic immune effects, sometimes positive. Radiation can release tumor antigens and increase in, essentially an effect that aids in immunity elsewhere, but also negative, lowering lymphocyte counts. Patients getting radiation for extensive disease often have drops in their lymphocyte counts, which correlate to far worse outcomes because they need lymphocytes to surveil against metastasis, which is why we have such high rates of reoccurring cancers. When we look at genomic instability, radiation may not kill every cell that it hits, and those that survive with damaged DNA would become more malignant. For instance, radiation of tumors develop mutation that can make them resistant or more aggressive if they reoccur. Radiation-induced angiosarcoma, a rare aggressive tumor, can occur in previously irradiated breast tissue 5 to 10 years later. So overall, when we look at biopsies, chemo, radiation, it is a vicious cycle. The standard sequence is biopsy, surgery, chemo, and radiation. Each step has downsides. Biopsies can spread it. Surgery, or removing the bulk, can suppress immunity. Major surgeries temporarily depress immune function, and the tumors sometimes grow faster right after surgery due to the wound healing factors. Chemo and radiation can damage immunity and normal tissue. Now, this is not to say that they shouldn't be done. Sometimes they need to be done to control the disease, but it highlights why supporting the patient's overall health through any of this is crucial. It also explains that the integrative emphasis on avoiding unnecessary procedures is crucial as well. For example, if a small tumor can be removed entirely with clear margins, skip the biopsy. If chemo is only going to extend life 2 months with severe toxicity and poor quality of life, maybe focus on gentler immune approaches instead. Most patients should be opting out of biopsies, chemo, and radiation for all of the reasons that I just listed. I highly recommend to everybody to go the alternative therapy approaches. Anytime you have any risk of cancer, I would, without a doubt, avoid any biopsies. Even just taking the preventative care to suppress tumor growth and reduce tumor growth with the therapies that we've discussed is far better for your body, not just immediately, but also in the long run, than going these standard routes of care. Now, you should feel empowered as a patient to ask your doctor, what is the absolute benefit of this chemo or radiation? What are the risks? And also to inquire about the protective measures. Now, if there's one truth that must be heard, it's this: cancer is not an enemy to destroy. It's a response from a body that is under siege, a body that is overwhelmed by toxins, suppressed immunity, chronic inflammation, and emotional trauma. It's not something to attack blindly. It is something to understand, to support, to heal. We have to stop viewing cancer as something to kill and start recognizing it is a sign that the entire system needs repair. And the truth is, biopsies can rupture containment, spread malignant cells, and inflame tissue that is already in distress. Chemotherapy and radiation devastate the immune system, destroy the gut, and often leave patients weaker, sicker, and more vulnerable to reoccurrence. These methods rarely ask, why has the cancer formed? They don't address the terrain that allows it to grow, and without changing the terrain, even the most aggressive treatment is only temporary. Healing begins when we stop the cycle of destruction and start rebuilding at the root. That means detoxifying the body of heavy metals, parasites, mold. It means responding and restoring the gut microbiome, supporting the lymphatic system, calming the nervous system, and awakening the body's innate intelligence. And cancer is not a battle to win. It is a wake-up call. And if we're listening and willing to listen and to take a path of discipline, truth, and real healing, we can change the outcome. And this isn't about false hope. This is about the reality that there's another way, a better way, and the time to choose is now. And I can tell you from experience with my father, with so many people that I've been in and around, I have seen how chemo and radiation can destroy quality of life, can ruin outcomes, can set people back so far. And our body is equipped with its own cancer-fighting capabilities. It is designed to fight off these things. Our body is amazing. It is powerful in its abilities. What we need to realize is that we have to trust it and give it the necessary tools to be able to fight these things like we want it to. And doing so means ridding our body of the toxins, ridding our body of the things that are suppressing these innate abilities, and providing our body with these tools so it can do the work that we're expecting it to and heal, ultimately heal in the way that we would like it to. Now, if you're somebody that is out there that's going through this process, if you are dealing with cancer, if you're not sure what to do, you're not sure where to turn, maybe you've just received a diagnosis, I know how hard that can be. It's a very tough thing to hear. It's very hard to live with, to take necessary steps forward, but there is hope. And it doesn't lie in more destruction. It lies in understanding, in returning to the foundational truth that the body is not broken beyond repair, and that it's responding exactly as it was designed to when pushed to the limits. Alternative cancer therapies don't suppress the body. They support it. High-dose vitamin C targets cancer cells through oxidative stress while promoting healthy tissue. We look at things like mistletoe and other biological therapies that modulate the immune system instead of compromising it. A healthy gut microbiome, which is the command center of our immune defense, can determine whether cancer takes root or our body clears it. Therapeutic diets that target, detoxify, and ultimately feed our immune system and healthy microbiome are so important. And we look at targeted detoxification, oxygen therapies, metabolic approaches, and emotional healing. All of these work together not to attack the body, but to restore it. And this is where true healing happens, not in killing cancer cells indiscriminately, but in correcting the internal environment so cancer can no longer survive and we can rid it for good. And the terrain is everything. So if you've been told there's no hope, if you've been given a protocol that ignores the rest of your body while focusing only on the tumor or only on the cancer, know this: there's a path forward. There's a path that doesn't leave you burned, cut, or poisoned. And there's a path that sees you, sees your story, your biology, your potential, and gives your body what it truly needs to heal. I have seen these very therapies absolutely change lives and buy people unbelievable amounts of time and give them true quality of life while they are fighting off everything that they're going through. So if you are alone, if you feel unheard, if you don't know where to turn, telling you these are the necessary steps to take. There's a lot of things that you can do. There's a lot of really important things that you're going to start noticing incredible benefits with, but this is the first step. Ultimately, your health is your responsibility. And I want to see so many people out there that begin to see this and awaken and use these therapies to see the results that so many other people have. And I feel like we've gone through so many things. There's so many more things that we'll go through. But I truly hope that I was able to offer some valuable insights today and give you some advice that you can hopefully carry forward. So thank you all for joining me today on this episode. I know that this one had a lot of in-depth information. If you are struggling, if you're somebody that doesn't know kind of next steps to take, if you are looking for a direction to go in, please reach out to me. If you have anybody that works in integrative oncology, if they're a naturopathic doctor, they work in holistic health practices, reach out to them, get their advice. And that's what this is all about. Opening the conversation, talking about not just research and science, but ultimately real world experiments, anecdotal experiences. So take that for what it is. And once again, I am so grateful for every single person that has tuned in today. It is such a blessing to have every single one of you listening in and be able to help any and every one of you on your journey. So thank you for giving me that opportunity, and I'll talk to you all next week. Thanks again. Thank you for tuning into the Vitalis podcast. If you found value in today's episode, we'd be so grateful if you'd leave us a rating and a review. It truly helps us grow. Share this episode with friends and family who are also on a journey towards deeper health and truth. And stay up to date with weekly episodes. Be sure to subscribe on Apple Podcasts or Spotify, and follow us on Instagram at the Vitalis Podcast. Please remember the content shared on this show is for educational and informational purposes only. It is not a substitute for personalized medical or mental health advice, nor does it establish a provider-patient relationship. Always consult with your physician or qualified healthcare professional before making changes to your health protocols.